Hello everyone, I am Naman Kumar, first year MBBS student at Kyrgyz National University, Kyrgyzstan. Today I am going to describe the anatomy of gallbladder. In this video, I will discuss its location, function, structure, blood supply, nerve supply, lymphatic drainage and important clinical aspects. Understanding the anatomy of gallbladder is essential for recognizing common diseases such as gallstones and inflammation, as well as for performing safe surgical procedure. So let's start our video. The gallbladder is a pear-shaped muscular sac located on the inferior surface of the right lobe of liver. Its function is to store and concentrate bile that is produced by the liver. Let's talk about the uh, parts of gallbladder. The gallbladder is divided into three distinct parts, that is fundus, body and neck. Fundus is a rounded blind end that projects downward past the inferior border of the liver. It is completely covered in peritoneum and touches the anterior abdominal wall. Body is the main central storage portion. It directed superiorly, posteriorly and to the left. Its superior surface is attached directly to the liver by connective tissue, while the inferior surface is covered by peritoneum and rests on the transverse colon and duodenum. Neck. The neck is a narrow, tapered superior portion that continues into the cystic duct. The mucosal lining of the neck form a tight spiral fold known as a spiral valve of Easter, which helps the duct to remain open. Now, clinical note: a small mucosal pouch called Hartmann pouch can sometimes form at the junction of neck and cystic duct. This is a common site for gallstones to get impacted. Now, relation of the gallbladder, which include anterior relation and posterior relation. In anterior relation, the anterior surface of the gallbladder faces the liver and its structure. On the upper end of gallbladder, porta hepatis lies on the right margin, and the right margin of the gallbladder run along the quadrate lobe of the liver. The lower end of the gallbladder projects down beyond the inferior margin of the liver. Now, posterior relation. Fundus is posteriorly related to transverse colon. Body is posteriorly related to second part of the duodenum. Neck is posteriorly related to the first part of duodenum. Now, its blood supply, lymphatics and innervation of the gallbladder. Arterial supply. The gallbladder is primarily supplied by cystic artery, which most commonly arises from the right hepatic artery, which is a branch of hepatic artery proper. Now, venous drainage. Small cystic veins drain directly into the substance of the liver or join the portal vein. Now, lymphatic drainage. Lymph drain into cystic lymph node, which then drain to the hepatic lymph node and ultimately the celiac nodes. Now, innervation. Innervation include parasympathetic, sympathetic and sensory. Parasympathetic innervation via the vagus nerve, cranial nerve 10, which stimulates gallbladder contraction and relaxes the sphincter of Oddi when food enters the duodenum. Sympathetic innervation derived from celiac plexus, which inhibit contraction. Sensory innervation carried by sympathetic fiber, but irritation of the overlying peritoneum can stimulate the right phrenic nerve, leading to referred pain in the right shoulder. Now let's discuss a very important topic, that is Caller's triangle, also called hepatocystic triangle. It is a critical surgical landmark used to locate the cystic artery. Its boundaries are inferiorly bounded by the cystic duct, medially bounded by the common hepatic duct, superiorly bounded by the inferior surface of the liver. Its main content is cystic artery and lymph node of Lund, also called lymph node of Mascagni. And now come to the clinical significance of gallbladder, which include cholelithiasis, which is also called gallstones, cholecystitis, which means inflammation of gallbladder, obstruction of the common bile duct causing jaundice, and last, Caller's triangle. It is very important surgical landmark which is very useful during cholecystectomy. Thank you for your attention.